In patients with chronic hepatitis C genotype 1 infection, a key relationship between virological response to PEG interferon and ribavirin and a single nucleotide polymorphism on chromosome 29 upstream of the IL28B gene coding for interferon lambda has been recently identified. In our study, we evaluated for the first time the relationship of IL28B polymorphism on sustained virological and on-treatment response in patients with ACV genotype 2 and 3 infection. We investigated a well-characterized cohort of patients whose original treatment had been the object of publication in New England Journal of Medicine in 2005. In the original study, we compared the sustained virological response rates in patients treated with PEG interferon alpha-2b and weight-based ribavirin for standard 24 weeks duration or a variable 12-24 weeks duration according with undetectable ACV RNA 4 weeks after the start of treatment. In particular, interactions between genetics and week 4 rapid virological response were studied and data were broken down among on-treatment and sustained virological response rate according to baseline features as viral load, fibrosis stage, body mass index, age, gender, and ALT quotient at baseline. This study included 268 of the 283 patients enrolled in the original trial. The 268 patients were selected for the current evaluation because they had provided their informed consent to genetic testing at the time of enrollment. All our patients were Caucasian. All the analysis focused on the discovered SNP 12, 97, 98, 60, 60, which had 3 possible genotypes, CC, CT, or TT. CT genotypes has been previously associated with a good treatment response. In our study, we also investigated 168 normal control subjects from the same geographical area, and the frequency of the CC genotype was compared between patients and normal control. The frequencies of CC genotype were 37% among patients and 42% among controls, whereas TT was observed in 15% of patients and in 8% of control subjects. Hardy-Weinberg equilibrium was assessed in the study population. Overall, 75% of patients attained sustained virological response. Rates of sustained virological response were comparable between standard and variable treatment arms. Therefore, the frequency of IL28B type was evaluated in the overall cohort. Among sustained virological responders, the good response CC variant was found in 82% of patients as compared to 57% rate observed among patients with a TT and 75% among those with the CT variant, respectively. The odds risk was 1.8. In contrast to previous observation in North American patients infected with genotype 1, in genotype 2 and 3 patients, in the absence of RVR, the sustained virological response rate for CT carriers was intermediate between CC and TT. Moving to the rapid responders, in this ACV genotype 2 and 3 population, 62% of patients attained rapid virological response. Due to the sustained virological response rate attained in up to 70% of rapid responders, IL28B genotype was not important in this subgroup of patients. Significantly, in patients with still ACV RNA positive 4 weeks after the start of treatment, IL28B genotype was associated with a significant increase in sustained virological response rates. CC was found in 87% of cases, whereas TT was found in 29%. CT was found at a intermediate frequency in 67% of cases. The difference was highly significant. The odds risk was 4.0. Finally, in a multivariable logistic regression model analyzing independent predictors of long-term viral clearance, the IL28B genotype was the second strongest predictor after RVR. Odds risks were respectively 2.1 and 3.2. To summarize, in patients with genotype 2 and 3 infection, IL28B gene CC variant is associated with sustained virological response. This association is largely driven by patients without rapid virological response. In this subgroup of patients, CC genotype is strongly associated with a 4 times increase in sustained virological response rates. We therefore believe that patients with genotype 2 and 3 infection without RVR may be classified as good or poor responders according to genetic testing. This IL28B polymorphism testing will provide, together with week 4 evaluation, relevant support to clinicians when consulting with their ACV genotype 2 and 3 infected patients.